right, hey guys, Dr. Hagmeyer here. I want to welcome you to my YouTube channel, and in today's video I want to share some really important information with you about the connection between MTHFR and Hashimoto's disease, and really why I test for it in almost every new patient that I start working with that actually either has thyroid disease, or we suspect thyroid disease, or Hashimoto's disease for that matter. So the other things we'll talk about in today's video is the damaging effects of high homocysteine, how that's tied into MTHFR. If you don't know about homocysteine or you've never had those levels tested, it's very, very important. If you have Hashimoto's disease or even a thyroid problem, or really any chronically chronic condition, that you get tested for homocysteine. Homocysteine is a vascular marker of inflammation in your body, and we know that inflammation is tied into many, many different root causes of the disease process. So we'll talk about that. We'll talk about the 7 essential nutrients that are needed for proper methylation and MTHFR function. And also what you can do from a dietary standpoint and a lifestyle perspective if you get tested and you find out that you do have an MTHFR variant. So even if you haven't been tested for MTHFR, there's going to be information in this video that will be very helpful to you. And if you already know that you have MTHFR, there'll be information in this video as well that will be helpful to you as well. So whenever we think about thyroid disease or we talk about Hashimoto's disease, it's very important to understand that these are really complex health problems with many, many different layers, right? And the genetic information that can be obtained by testing for this MTHFR variant can help your doctor when it comes to treatment, right? Our bodies are bombarded day in and day out with toxins and just a variety of pollutants. In fact, liver function and detoxification is such an important part of managing thyroid disease and managing autoimmune diseases that I did a 2-part video series that you should really check out, where I talk about how to support your liver and the connection between liver function and thyroid function. So again, I'd encourage you to watch that. So if we take into consideration that, again, our bodies are just being bombarded day in and day out with these toxins, and now we throw in things like a poor diet, and we throw in bad dietary choices, and we throw in stress, and we throw in other hormonal imbalances, maybe sex hormone imbalances, maybe we have gut issues and gut dysbiosis, maybe we also have small intestinal bacterial overgrowth, or leaky gut, or gluten sensitivity, or adrenal stress. The list goes on. But all of these are tied into the methylation pathways and the methylation process. And so methylation is really like a switch that turns on and off or influences various biological actions within our body. The reason we test for MTHFR and why it's so important is that it provides clues and provides information on really how to provide nutritional and even lifestyle support in the presence of a gene mutation. That's really why we test for it. And if you're struggling with Hashimoto's disease or thyroid disease, then knowing if you have this MTHFR variant can be used to offset the nutritional deficiencies as well as inflammation that often go hand in hand with thyroid disease and with Hashimoto's, or really other autoimmune diseases as well. So what exactly is MTHFR and why is it so important if you have Hashimoto's? Well, first off, MTHFR stands for methyl tetrahydrofolate reductase, and it's a name given to both the gene and the enzyme that the gene makes. Okay? The enzyme takes folic acid and folate and converts it into the active form that the body uses called methylfolate. Now, often people with Hashimoto's disease or thyroid disease suffer with elevated levels of homocysteine. High levels of homocysteine is what is known as an independent risk factor for heart diseases and strokes. So what that means is that if you go to your general practitioner or you go to your cardiologist and you go in and you have a yearly physical and you have blood work done, your doctor may tell you that you have excellent cholesterol levels, your blood pressure is good, your LDL cholesterol, which is your bad cholesterol, is where it should be, it's low. Your HDL cholesterol, which is your good cholesterol, is exactly where it should be. Does that mean that you're not at risk for heart disease, right? You walk out of that doctor's office thinking, wow, I just scored an A on my report card for heart health. Does that mean you're really not at risk for heart disease? And the answer is not at all, right? When we say that something is an independent risk factor, what we're really saying is that despite having normal cholesterol, normal blood pressure, normal HDLs, normal LDLs, that if you have high levels of homocysteine, you are at risk for heart attacks and you are at risk for strokes, okay? And that's not all. High homocysteine levels above 10, increase one's risk for dementia, increase one's risk for Alzheimer's disease, are associated with depression, of course are associated with heart disease, and of course are associated with strokes. So if you look at this picture here, homocysteine is an inflammatory marker inside the blood vessels. It damages the blood vessels. It's made in the liver, and then it circulates throughout our circulatory system, our blood, and ends up in tissues and blood vessels and things like that where they cause damage. And the areas that are most vulnerable are going to be the heart and the brain. So MTHFR variants or mutations are tied into this process and are tied into homocysteine levels. All right. Now there are two main variants of the MTHFR gene. Right. There's what's called the 677T, and then there's what's called the 1298. One is bad and the other is really bad. Right. And it's the 677T which is the really bad one. Right. Now if you have two copies, that's the worst scenario because the enzyme involved in the methylation will be affected to the greatest degree. So if you have two copies of the genes, two abnormal mutant genes, we call this homozygous, homo meaning the same. If you have one copy of the 677 and one copy of the 1298, we call this heterozygous. Now depending on which variant you have and how many copies you have can reduce your methylation capacity anywhere from 30% to 70%. Two copies of a mutant or variant gene is worse than having one mutant or variant copy of this gene. That means for some of you who are watching this video, on a good day, your ability to properly methylate, regulate inflammation, and all the other things that this MTHFR gene is involved in is only as good as 20 to 30%. And this can pose a huge, huge problem. Again, often overlooked by your general practitioners, your cardiac doctors, and so on and so forth, most within the allopathic community. Remember, having these genes affects the way your affects the way your liver detoxifies pollutants in the air that you breathe, the water that you drink, and your overall lifestyle factors, right? The food you eat and proper methylation is needed to help get rid of the toxins and to help regulate inflammation and those inflammatory markers like homocysteine and C-reactive protein and many of these other immune signaling inflammatory chemicals. So how does one know if they have a mutation in one or both of these genes that are involved in methylation, right? Are there certain symptoms that you should know about? And the truth of the matter is there's really no way of knowing unless you get tested, which is of course very easy to do. I do this testing done all the time with patients. I had my test done about 1.5 years ago. Luckily, I did not have a mutation. My wife did not have a mutation. And so again, realize that these are genetic, right? So if you have a copy and your spouse has a copy, you're going to pass these on to your children. Now, as far as symptoms of poor methylation, the problem is that when you look at these symptoms look like everyday complaints that millions of people experience and tend to just brush off daily because they're just so common. So rather than thinking about the mutation of this gene will cause X condition, I look at testing for MTHFR as one of the puzzle pieces that could be contributing to the overall bigger picture of what's going on in that individual. But let me go through some of these symptoms, and my recommendation would be that if you can identify with half of these, then you definitely should get tested, you and your spouse, and if you have kids, them as well. So symptoms or problems that we associate with methylation can show up in a number of ways. Number one, impaired ability to clear out certain toxins such as cadmium, mercury, and lead, all right? Arsenic, for example. Hormonal imbalances such as estrogen dominance, right? Brain fog, anxiety, depression, learning difficulties, heart problems, right? We know that people with thyroid disease have an increased risk of heart disease, right? I believe it's 1 in 8 people who have thyroid problems will actually die of heart disease or die of a heart attack, right? So again, very strong connection between inflammation, heart disease, and thyroid problems. The other symptom we think about is multiple chemical sensitivities, right? Those could be things that show up as joint pain or infertility. We know that MTHFR symptoms may show up in autoimmune diseases or dementia or Alzheimer's disease and a variety of other problems that you see listed here. So just a quick review. We talked about what methylation is. We talked about how problems with methylation can lead to high levels of homocysteine. We talked about some of the most common symptoms associated with high homocysteine: strokes, heart attacks, depression, migraines, autoimmune diseases. What can you do if you're watching this and you have high levels of homocysteine and your B12 levels keep coming back on the low end, or you have Hashimoto's disease? Well, number one is get tested so that you can understand one of the potential reasons behind these symptoms. Number 2, avoid all packages, right, that contain folic acid. Folic acid is synthetic folate. And if you have an MTHFR variant, you will not break down folic acid. And so in this case, you're going to have these levels build up in your body, right? You're going to cause a metabolic block, right? Number 3 is you need to take methylated vitamins. The 7 essential nutrients needed for proper methylation include methylated folate, which is active B9, 𝐓𝐾𝐒, which is active vitamin B12. You need P5P, which is pyridoxal 5-phosphate, which is active vitamin B6. You need niacinamide, which is B3. You need magnesium glycinate. And then, of course, things like vitamin D and betaine with pepsin or HCl, also known as trimethylglycine, is also part of those pathways. So some final thoughts that I want to leave you with. Number 1 is get tested. Your physician can include MTHFR testing as part of your blood work, but if they don't know about MTHFR, chances are they won't understand the importance of being tested for it. And if you are struggling with thyroid problems or autoimmune problems, or any of the symptoms that I mentioned before, testing for MTHFR and making those lifestyle changes can have a huge impact on your health. Number 2 is, while I recommend everybody minimizes the exposure to chemicals in and around their house, their body, chemicals that they come in contact with, having MTHFR puts you at an increased risk for toxic burden, right? So that's very important to understand. Number 3 is supporting liver detoxification with nutrition and supplements is incredibly important. Don't overlook these things because these, again, are very, very important. And so, while I didn't mention this earlier, 60% of T4 to T3 conversion takes place in the liver. And many people that are diagnosed with Hashimoto disease and or have low thyroid levels or low T3 levels, high homocysteine levels, because of poor methylation, may be a potential cause of this. So again, thyroid problems that show up with low T3, just realize that 60% of that T4 to T3 conversion takes place in your liver. And so supporting the liver very often is also going to help support your methylation pathways. Number 4, start reading ingredients and labels. If you come across an ingredient that says folic acid, avoid it. Don't take it. If you have supplements at home and they say folic acid, again, avoid those. Most of the time, these are going to be the same foods that use words like fortified or enriched. So if you see those, just ditch them. They're just not good for you. And number 5, from a dietary standpoint, one of the things you can do to actually help this process is eat foods that are actually high and rich in sulfur. These are going to be things like foods like vegetables like asparagus, broccoli, cabbage, garlic, squash, grapefruit, avocado, spinach, right? If you or someone you love is struggling with Hashimoto's thyroid disease, these high sulfur-based foods will help replenish glutathione stores, which is the body's master antioxidant. And one point that I want to quickly make here is if you are afraid of eating these foods because you heard someone on Facebook or a podcast spout out that these foods are problematic for thyroid disease, please go back and watch the video that I did where I talk about the real cause of goitrogens and thyroid nodules. Again, that was a video I did a while back. You can go through that on my YouTube channel or just do a Google search on that. Optimize gut health. 20% of thyroid hormone conversion occurs thanks in part to the kinds of bacteria that live in your gut. So remember, when it comes to thyroid disease, it's not just a matter of taking thyroid replacement. Okay, if that's all your doctor ever does and ignores the role of the liver, which is responsible for 60% of that T4 to T3 conversion, and ignores the role of gut health, which is responsible for another 20% of that T4 to T3 conversion, you're going to have low thyroid levels. And this typically shows up in those individuals who take thyroid replacement and never feel better, or they take thyroid replacement and they feel worse, or those patients who take thyroid replacement feel a little bit better for a short period of time, but 6 months later, 12 months later, they're back to feeling lousy and all those symptoms of low thyroid return. Another thing that I want to quickly point out is, it's so important, is if you have one or more autoimmune diseases, is that the gut plays a pivotal role in the overall development of autoimmune diseases. And we're talking things like Hashimoto's disease here. A big part of the immune system lies in the gut mucosal tissues. And supporting the gut also is going to help support your autoimmune disease. So there you go. Hope you enjoyed today's video. If you did, share it, comment below. Tell us, tell us what you enjoyed about today's video. And again, make sure you hit the subscribe button. We'll see you next time. Take care.